out of control and spreading fast. A highly contagious coronavirus strain in the UK. Borders are being closed in Europe, flights canceled around the world. So, where does it leave the global fight against the pandemic? This is Inside Stories. Hello and welcome to the program. I'm Mohammed Jamjoom. It may be up to 70% transmissible. A coronavirus variant in southeast England is spreading and spreading quickly. But health experts say there is no evidence it is more deadly or will react differently to a vaccine. Prime Minister Boris Johnson has imposed stricter restrictions in some parts of the country. It's believed the virus mutation was first detected in September, and the UK government has been aware of it since last month. Scientists wanted tougher lockdown measures introduced then, but Johnson's been accused of ignoring their pleas. The World Health Organization said it is working closely with the UK to understand what impact the variant could have on how we deal with the pandemic. The strain has so far been detected in the Netherlands, Denmark, Italy, and Australia. The Netherlands was the first to announce a 2-week flight ban to the UK on Sunday. Several other EU countries are also now suspending transport links with Britain. Kuwait was the first non-European nation to impose a travel ban on travelers arriving from the UK, while Saudi Arabia has suspended all international flights for a week. And Germany has called for a coordinated response to the crisis to avoid it spreading elsewhere. Some countries have already started inoculation schemes and others are now receiving supplies of the Pfizer vaccine. But while rich nations have rushed to sign multi-million-dollar deals, there are fears those less well off will miss out. Campaigners warn 9 out of 10 people in at least 70 poor countries won't get vaccinated next year. However, the World Health Organization says almost 2 billion doses of potential vaccines have been secured under a global initiative for low and middle income nations. The doses could be shipped out once approved in the first quarter of next year. All right, let's bring in our guests. In Lancaster, we have Dr. Mohammed Munir, a virologist and lecturer in biomedicine at Lancaster University. Emmanuel Capobianco is director of health at the International Federation of Red Cross and Red Crescent Societies. He joins us from Geneva. And in London, Max Lawson, head of inequality policy at Oxfam International. Welcome so much to each of you. Emmanuel, let me start with you today. As I understand it, scientists are concerned by the variants in the coronavirus, but they are not surprised by variants in the coronavirus. Why is that?
Well, we know that viruses mutate. That's part of what they do. And so we were not surprising to see mutation adding in this very case. But what we are seeing is a very high number of mutations, and there are indication of potential higher transmissibility of the virus. Science is actually studying better the information that we do have, and we need to keep a very close eye on this virus and understand better how it will be functioning, how is it functioning, and what kind of additional risk the virus presents for not only the UK or Europe, but the entire world.
Mohammed, health officials in Britain say that this virus mutation is proving to be up to 70% more transmissible. But that estimate is based on modeling and has not yet been confirmed by lab experiments, correct?
Well, that's true. That's true. I mean, if we really look onto this new variant, we have 17 different mutations that is making this particular variant a bit more prominent than what we would have expected from other viruses. And out of those 17, 3 of them, they are of particular concern. One of them is 501 Y2N mutation, and that is really the basis that this virus is highly transmissible. And I mean, at this moment, if we look onto the positive cases in Greater London and Southeast region, 6 out of 10 positive cases belonging to this new variant. So that is really is defining its nature and becoming predominant in this part of the world.
Max, it's been reported that the WHO says that this mutation of the virus was identified in London as far back as September. Should more have been done sooner to try and understand this variant and to try to stop its spread?
I think definitely. I mean, the lack of transparency, the poor governance, it's not unique to the United Kingdom, but you can see big mistakes are being made and it's costing lives. It will cost lives. The sooner the world can respond to developments like this, the better. And the key to all of this is vaccinating the whole world. And at the moment, we're looking at a situation where rich countries are hoarding the vaccine and protecting their big pharmaceutical companies, whilst the rest of the world has to watch and get scared of this new variant.
Emmanuel, several countries in Europe have started barring travelers coming in from the United Kingdom. But British officials have said that this variant has already been detected in other countries. By barring travelers now, I mean, is it essentially too late to be doing this? I mean, is it more likely that this mutated strain of the coronavirus is already out there?
Well, the indication is that mutated virus may be already out there. This is a precautionary measure that many countries are taking based on preliminary information. You may remember the discussion back in March about closing of airspace and delays about that. In many countries, I think countries are taking a much more proactive stand at this point, and I think that is understandable based on the information that are available. But again, we'll have to follow the science in the next few days and weeks to clarify the risks linked to this specific variant.
Mohammed, scientists have been on the lookout for mutations that could potentially enhance the virus going forward. How long would it take for the coronavirus to evolve to the point that a vaccine would be rendered ineffective? Is that something that could happen quickly, or would this take much more time?
Well, we do know that most of the viruses, particularly the RNA viruses, and SARS-2 is one of those RNA viruses, they mutate much more than the DNA viruses. So therefore, they accommodate the mutation over the time. SARS-2 is not too bad in accommodating mutation. So at the moment, what we have seen, 1 to 2 mutations are occurring per month. So that means by now, 20 points mutation have already occurred in this SARS-2. And when we talk about the vaccine efficacy, the vaccine induces immune responses against an array of different viral components. So few of those mutations, even if those occur all together, is not gonna make vaccine ineffective. But the important point is that if this virus keep mutating, and it would accommodate all of those mutations to the extent that most of those important sites are mutated into newer version, at that point, the vaccine efficacy would become very low or negligible, and that will take time. It's not going to happen overnight. For example, this particular variant, although it was detected back on 20th of September, but that does not guarantee that this has been there on 20th of September. It might have been accommodating there for a longer time. So viruses do take time to mutate at the point where the vaccine would become ineffective.
Emmanuel, I saw you nodding along to a lot of what Mohammed was saying there, so I want to get your response to what he was talking about.
The immediate response is that we do have vaccines that are now effective and are already being distributed. And this is one of the best tools that we do have to reduce mortality due to this virus. And these vaccines are likely to continue being effective for the foreseeable future. So I want to make sure that we keep that hope of the vaccines, and we do all what we can to ensure that everyone everywhere in the world can have access to the vaccines as soon as possible. And that, for me and for the Red Cross in general, is a top priority at the moment and for the entire year that we have ahead.
Max, I want to ask you to expand on an important point that you were making just a few moments ago, which is, about how wealthy nations are buying and hoarding more vaccine stock than they need. I mean, that is a huge concern right now. The People's Vaccine Alliance has said that unless drastic measures are taken, nearly 70 lower-income countries will only be able to vaccinate 1 in 10 people in this next year. How much, obviously, does that concern you, and what can be done to combat this?
Well, it's very concerning. On the one hand, you have a situation where 9 out of 10 people in the majority of developing countries watching this program will not have access to any safe or effective vaccine before 2022 at the earliest. Obviously, that's completely unacceptable. And on the other hand, you have rich nations that have bought enough vaccines to vaccinate every single one of their citizens 3 times over. So 3 times more vaccine than they need. That's obviously a crazy situation. But then you add on top of that the fact that the thing that is artificially rationing supply in the world is that despite public money being used to develop these vaccines, billions of dollars of taxpayers' money, the licenses for these vaccines have been given to huge pharmaceutical firms like Pfizer, who cannot produce enough for the world, are charging a very high price. So you have a situation where rich nations have enough vaccine, but they're paying a very high price for it, even though they funded the research themselves. And poor nations will be lucky if they get this vaccine before 2022. And that was even before this new variant, this new mutation, which shows you just how important it is that we get the whole of the world vaccinated as fast as possible. Otherwise, you could have a situation where rich nations vaccinate their population, it continues to mutate in other countries, and then they find that their vaccines are ineffective. So we have to break through this system of monopolies and high prices and pharmaceutical corporations and mass produce vaccines for the world. The way to do that is to have open licensing, open recipes, if you like, for these vaccines, so that companies and vaccine producers all over the world can mass produce these safe and effective vaccines as fast as possible. At the moment, that is not happening.
Mohammed, in South Africa, a version of the virus has emerged which seems to share some of the mutations found in the variant that has been discovered in England. What else do we know at this point about that variant?
Yes, the South African variant, basically, and as well as the Brazilian variant, those were having mutations similar to this variant in the UK. Those were independent events because those were identified quite early in time, and a lot of research has been already conducted onto those. So if we really translate those impact onto this this new variant here in the UK, it appears that it would certainly have impact onto the transmissibility, but it didn't have any impact onto the disease severity as well as onto the vaccine efficacy as it stands.
Emmanuel, vaccine hesitancy is such a big problem right now. Are you concerned that news of this virus mutation will make people who are already skeptical of taking the vaccine think that since there is a new variant, it's not worth getting vaccinated? I mean, is this only going to increase vaccine hesitancy and the anti-vaccine sentiment that is out there?
Well, the problem of vaccine hesitancy is real and is big. And there are a number of researchers that have demonstrated that only a tiny percentage of the population, around 30%, would be ready for a vaccine right now. And certainly these news about the variants can add more hesitancy. I think what we need to do is really working in transmitting the right information about the importance of vaccines, how important they are to save lives, particularly of the people that are most vulnerable, and then continue investing in that communication that is certainly going through radio and television, but particularly needs to go at the community level, particularly in those populations that don't have access to traditional or social media, to ensure that actually the acceptance for the vaccines increases, because we know this is one of the best tools that we do have to stop this pandemic.
Max, when it comes to distributing a limited number of vaccines, it seems like the only criteria that has emerged thus far, globally I'm speaking about, is that along with essential workers, the elderly and people with chronic illnesses are on the list first to get the vaccine first. Going forward, from your vantage point, what other criteria should governments take into account when it comes to distributing the vaccine? As an example, in the US, minority populations are disproportionately affected by COVID-19. How should governments going forward go about determining who the most vulnerable populations are and whether or not they should be prioritized as such?
I think it's a great question. I think, you have a situation where people of Afro descent in Brazil are 40% more likely to die of COVID-19 than white people. So, obviously you've got you can have critical debates in every country about who desperately needs this vaccine first. And then you have to look at the economic impact too. In many poor countries, the economic impact is taking as many lives. It's leading to hunger, it's leading to destitution. So, we need to look at economically active groups and what can we do to get our economies going too. But I have to underline the point I made earlier, which is all of this is entirely academic when there are simply not enough vaccines being produced for the vast majority of humanity. It's an academic discussion when they don't even have enough vaccines to do their health workers, let alone talk about other groups, when rich countries can vaccinate everybody 3 times over. So I think the primary thing we need to do is fix this supply problem. And the way to do that is to face down pharmaceutical corporations, reduce the price and mass produce a cheap and effective vaccine, which is ultimately is in the interests of rich countries as much as it's in the interests of developing nations.
Emmanuel, from your perspective, what you just heard Max speak about, this potential of collectively facing down pharmaceutical groups, trying to ensure that it's not just the rich nations that are being able to hoard the vaccines, trying to ensure that there is more equitable distribution, there are enough doses to go around to vaccinate everybody in the world, no matter the financial status of the country or the group. Is this something that's doable, given the structures that are in place?
It's probably something very difficult. If I can bring a ray of hope, is certainly referring to COVAX, which is an initiative that has been launched this year that aims to bring 2 billion doses to low-income countries. It's a multilateral initiative that has been put together by the World Health Organization with other organizations like Gavi and CEPI. And the idea is really to bring this equity. There was a press statement, a press release last week that actually confirmed that 2 billion doses should become available for 92 low-income countries starting in 2021, with the first doses going to health workers and then progressively reaching up to 20% of the population in these 92 low-income countries. This is a massive solidarity effort that has been ongoing, and I think it requires more support financially, but as is going to have an impact. Is this going to solve the problems of the entire world? No, but is this going to address some of the inequities? Yes, and I think COVAX is a good instrument that needs continued support and advocacy from everyone who has a commitment to fair and equitable distribution of vaccines.
Mohammed, have there been any more advances when it comes to medical therapies to treat COVID-19? Is there any consensus at this stage when it comes to, for example, monoclonal antibody therapy?
Yes, absolutely. Advancements have been made for different treatments and as well as the vaccine. I mean, we generally talk about Pfizer, Moderna vaccines, but of course the AstraZeneca, Johnson & Johnson, all these are progressing down the line as well. And I mean, adding the point being made earlier, it's not just the commitment. I think it's the scientific and the pharmaceutical structures that's going to contribute into equitable distribution. But in terms of the therapeutics, certainly the monoclonal antibodies are on the horizon. Few of the monoclonal antibodies have had HAs that allowed not to have it approved, but certainly the progress are being made.
Max, the European Union has been so criticized this past year for its handling of the pandemic. There are meetings going on right now to try to get to some point where there is more coordination between countries because there is so much fear about this new mutation. Are there any indications that the European Union will do anything differently this time, that it has learned its lesson from the failings of the past year?
I certainly hope so. I think, within the European Union, you have some of the governments that have handled this crisis best in the world. So you have some really good experience. And to be honest, you're sitting here in the UK, I think I'd rather be in the EU in terms of our government and our ability to handle this crisis. All governments are under pressure here, but I think it's crucial that governments like the EU and Joe Biden, the president-elect, look beyond the very short-term vaccine nationalism to think of the bigger picture and to invest in vaccinating the world in a safe and effective way as quickly as possible. They have the means to do this. You know, I mean, we're all very, very happy and hopeful seeing those first people being vaccinated in the US, in the UK. We need to see that hope and that faith in the future spread all over the world. And that's only going to happen if rich nations in the EU, in the US, commit to free and safe and effective vaccines for absolutely everybody. And the only way they will do that is to smash through the system of pharmaceutical profits and monopoly. The COVAX setup is good, but as your interviewer said, even if it manages to do what it's set up to do, which seems very unlikely, and we saw leaks just a week ago saying that it's actually at risk of failure, then it will only be able to vaccinate 2 out of 10 people in developing countries by 2022. We have to do better than that. We have to do better than that for the people of those nations. But also, as we said earlier on, if we want to stop this virus in its tracks, the virus anywhere is the virus everywhere. So we cannot do that through rich country charity. We can't do it through donations. It has to be about a systematic attempt to flood the world with cheap and effective vaccines. And it's COVAX, but it's got to be a lot more than that.
Emmanuel, do you believe that these new restrictions that are being put in place in England are going to complicate the rollout of the vaccine?
I'm not sure about that. I think the vaccines will roll out. There will be some hesitancy, but there's also a lot of people who recognize the importance of having the vaccines, and there will be efforts made to ensure that particularly healthcare workers, social workers can receive this vaccine as soon as possible. One thing that I wanted also to mention, if you allow me, Mohammed, is while the vaccines are being rolled out in the UK, in the US, and the rest of the world in the future, we need to remember that this process will be a slow process. And so public health measures that have been put in place over the past several months, going from the physical distancing to the use of masks and sometimes to the imposure of hard restriction, will have to continue if we want to contain this pandemic. At the same time, we will need to strengthen in all countries the ability to do the testing, the contact tracing, the isolation and quarantine of cases. The effective control of epidemics passes through the contact tracing, the testing, the contact tracing, and the isolation. And it's something that we will continue to have to do all over the world and improve in the way we do it.
And Mohammed, let me ask you to expand on the point that Emmanuel was making. I mean, from your point of view, does it seem to you like people around the world are understanding that it's not just the vaccine that's going to wipe this out, that the vaccine perhaps is the beginning of the end, but that these practices that Emmanuel spoke about just a minute ago, social distancing, mask wearing, all the other guidelines that are in place to try and help prevent the spread of COVID-19, are people, from your vantage point, understanding this, or do they just believe that, hey, this is going to be gone soon?
Well, the vast majority of people, and not only in the developed world, but also in the developing world, they assume that the vaccine is a magic bullet and it's going to change the whole scenario that what we have been through in 2020. But I think it's a great responsibility on the government, on the community level, to penetrate the information to make sure that people understand that this is not the magic bullet. This is certainly a good start into ending this pandemic. But the vaccines that we are having, they are life-saving vaccines. These are not the one that would be blocking the transmission of the infection. Certainly, we have to follow all those public health principles for unseeable future until we reach to the herd immunity. At that point, we will be in the position to really slow these restrictions and try to get into new normal.
All right, we have run out of time, so we're going to have to leave the conversation there. Thanks so much to all of our guests, Dr. Mohammed Munir, Emmanuel Capobianco, and Max Lawson. And thank you, too, for watching. You can see the program again anytime by visiting our website, aljazeera.com. And for further discussion, go to our Facebook page. That's facebook.com/AJ Inside Story. You can also join the conversation on Twitter. Our handle is @AJ Inside Story. From me, Mohammed Jamjoom, and the whole team here, bye for now.